My name is Paula Williams and I head up the maternal neonatal health unit in R&D GlaxoSmithKline, which is a major pharmaceutical company. Working in the pharmaceutical industry is quite different from working in academia in many respects, but I do see that the two actually starting to merge much more. In fact, there are many people now that have joint appointments. But I think a key difference between academia and the pharmaceutical industry is that in the pharma industry, you can't rely on staying in one therapeutic area, and you can become an expert and real depth in one disease area, for example, and then the drug that you're working on fails and suddenly you have to move on to another project. And also business imperatives change as well. So I've worked in many different therapeutic areas over the course of my career. And so you have to have a learning agility, I think, to shift.
My name is Christina Radha, and I'm a group leader at the Laboratory of Molecular Biology in Cambridge. I spent most of my career in the same research institute. From my experience, the great advantage of working in academia rather than in corporate environment is that you really are allowed to take the long-term view on your question. So I have been working for 20 years on one particular aspect of immunology. I think if I had to rely on raising finance and grants constantly, it would have been quite difficult to maintain that focus. It's taken 10 years to get to the beginning of the answer, and it's taken then another 10 years to get to understand how it works. So in the long term, it's something that is more difficult if you have to raise money every 2 or 3 years for your research. And I think maintaining those kinds of environment is really important for science.
I'm Julie Barnes. I'm the Chief Executive of a company called Abcodia, which is focusing on the development of tests for the early detection and screening of cancer. So I'm a scientist. I did a first degree in pharmacology and my second degree in neuroscience. I then joined the pharmaceutical industry, Glaxo as it was then, spent the first 15 years of my life there doing some very exciting science, drug discovery, early stage research across a number of CNS disorders. And after about 15 years, I decided to take the leap into smaller biotech. I think really rather largely to get back to the science. I felt that I'd kind of become a little bit more too remote from the science that I was doing at the first instance. So joined the biotech sector and joined a company called BioWisdom that was building informatics solutions based on a lot of legacy electronic literature and information. That was a really interesting time. Spent 10 years there driving solutions through, worked closely with AstraZeneca. And when that company came to a natural exit, I set up my own consultancy business for a while. And my first project was actually working with Professor Ian Jacobs at UCL, who had actually established this biobank through his large prospective study in ovarian cancer screening. And so really that was my first project. And we, together with Chris Hodkinson, my business partner at the time, have set up Abcodia from that point.
My name is Anna Cvejic, and I'm Senior UK Career Development Fellow and Group Leader at the Department of Hematology at the University of Cambridge. And I'm also Honorary Faculty Member here at the Sanger Institute. Between 2008 and 2012, I had 2 kids. And every time when I returned from my maternity leave, I was questioning myself, should I continue my work in science or should I move to industry? And this question actually came from the feeling that I wouldn't be maybe able to secure independent position at the academia, and I felt a lot of pressure and a lot of stress, and I was thinking whether maybe moving to industry would make my life easier, less stressful, and maybe easier to combine a work life with my now young family. And I think that every postdoc who is asking themselves this kind of question, I think they should first do their best to really explore all the options of getting independence, because at least this is what I feel, is that working in academia allows you to be free and do independent science and explore the things that you're interested in. And I'm not sure if in industry this type of freedom really exists.
I'm Jane Greatorex. I'm a senior scientist at Public Health England. As a senior scientist, I'm responsible for the streamlining and designing of blood-borne virus diagnostics at Addenbrooke's Hospital. Nationally, I coordinate a couple of projects that pull together diagnostic development with it between our network laboratories. And then, again, as a collaboration between the Sanger, the university, and Addenbrooke's Hospital, I'm responsible for helping the implementation of next-generation sequencing into the clinical laboratory. Working in public health, and I work for Public Health England, is working with the government. Compared to academia, we have a much more direct role to play and benefits for the nation, for the people. So our goals really are to provide better healthcare, better outcomes, and that's all the work we do. Our diagnostics and our research in epidemiology are aimed at that. And I think that is different to academia in that we do not do the very basic science. The other major difference is the funding streams. We're much more like the commercial sector in that aspect, in that we can't get funding from the research councils, but we can get funding internally, but we do that by business case. So we have to justify what we do. Everything that we do. So even small pots of money, small startup or proof of concept projects have to be put to somebody saying, yes, this is worth doing. And that's rather different, but much more immediate than in the academic sphere.
I think there was a case in the past where working in the pharma was very insular and private and behind locked doors, and I think it's much more open now and there's much more encouragement to publish, and that means that actually collaboration with academia is much easier because we actually ultimately have the same aim in terms of making medicines and making patients better, and so I think those barriers are really broken down now.